Good evening, Endo Summit Live, and welcome to this evening's presentation. We have an amazing physical therapist here to talk to you about some of the unmentionables that go with endometriosis. Please welcome from New Jersey, Neva Herzig. Neva, can you introduce yourself?
Hi, yes, I'm Neva. Hi, everyone. I am a pelvic health physical therapist up in northern New Jersey. And I have a slide in a few minutes that'll talk about me, but I am a mom of two teens, and I'm a dog mom to Mr. Roger, the Australian Labradoodle. I pretty much raised my kids through my work now, but I have a physical therapy place called Core Dynamics Physical Therapy up in northern New Jersey. And in these past 10 years, I have attended the Integrative Women's Health Coaching Program. And then later on, decided I just wanted to pursue sexuality and sex counseling and education. So I finished the program from University of Michigan, and now I'm an ASEX sexuality counselor, which is a great add-on to pelvic health therapy.
I'm curious if your work in pelvic health therapy made you draw that connection between the two, and if it really strengthens your ability to connect to patients.
Yeah, I mean, great question. I first of all, I think my curiosity wanted me to get to this place. And once these programs became available and open for physical therapists and other practitioners, I thought this would be a perfect blend. I saw other practitioners using it. So, yeah, definitely. I put it into every patient I see, whether it's specific on sex or other ways of helping educate and coaching and just opening up their world to sexual health. So it is a great blend.
I know there are some very fabulous physical therapists who have paired it, but it is such a rigorous and difficult curriculum that there aren't a ton of them out there, but I'm very impressed with when I see people have both. It's very interesting for me.
Yeah, it was a year-long process for the education part. And depending on your pursuit, if you want to go on and become an ASEX certified counselor, then there is a long process to do that. It's also, has a few dollar signs along with it, but it was well worth it. And I felt like that certification was important to me to complete the whole circle there.
Excellent. All right. Do you have something to share with us this evening?
I do. Let's open this up. Okay. Oops. All right, you guys are good? You see it?
We are. How about, can you do the presenter move? We see the notes one,
Oh, hold on one
which is
second.
fine. We can make that work.
I think I can swap them. Better?
Ah, gee, I just love the way the slide looks like with my back. It looks so good. It
Oh,
looks like we went to a museum. I love it.
thank you. Yes, I'm not a designer by any means, but let me switch my monitors here a little bit. I know I told you about my fancy, I'm not a Zoom person by any means. I treat in clinic pretty much. Anyway, so we're going to talk about embracing sexual pleasure while living with endometriosis tonight. And I already told you guys a little bit about myself. And so we're just going to get right to it. So I thought a great way to start was with this quote. Emily Nagoski, for those of you guys that don't know who she is an author. Most people know her from her book, Come As You Are. And she also co-authored a book with her sister, Amelia, called Burnout. And this is a quote from that. And Emily is a sexual educator. She's a researcher. She's an author, an activist. Our bodies can disappoint us and the world can punish us. punish us when our bodies aren't what they should be. So we are not suggesting that you love your body like that's an easy fix. We're suggesting you be patient with your body and with your feelings about your body. I think that sits so well in the community and the endometriosis community, probably the whole world, but a few words that really just stuck out. And this is why I wanted to start with this is I think often we talk about our bodies disappointing us, whether we're living with a chronic pain disease or not, and the fixing mode and hating ourselves and becoming patient. So I thought all of those were really important to really just start out, and hopefully that speaks to you guys. By the way, I highly recommend both Burnout and Come As You Are as books. They are just amazing. You can get them on Audible and all that stuff. Okay, so how can you feel good and feel pleasure when your body is in pain? Hurts so good. I hope I'm not dating myself. John Cougar, one of my favorites in the 80s. Great songs. But, the pain and pleasure aspect has come together in so many respects. Pleasure and pain are basically processed in the same area of our brain. And we talk about something hurting us so good. It felt so good, but it was painful. And that we can see in different activities. But when we talk about something like a chronic pain syndrome, you might say to yourself, like, what is she talking about? Like, this pain is not pleasurable, right? So I took it into a different concept, and I'll talk about that in a second. But pain is usually a symptom. And when it's part of a chronic pain disease or an injury that's going on for so long, pain becomes the disease. We start talking about pain, we identify as pain, and it starts just taking over everything we communicate about. And I'm even at fault in my own clinic. I ask people about their pain, and we have to kind of go outside of the box a little bit. And when I'm talking about when it's coming from the same area of the brain, we're also talking about when pain occurs, we get endorphins that are released. Well, those endorphins are also great chemicals, right? And endorphins try to stomp down some of that pain. So they want to block the pain signals. And guess what? Endorphins are also released when we're having sex, but they're also released when we're doing like an exercise or just having a good time. So we can bring that pain and pleasure into one. Um, so we want to look a little bit at this as a reward punishment system, and we often look at pain as the punishment and pleasure is the reward. So how can we start rewarding? So we want to show me the pleasure, show me the money, show me the pleasure. What is pleasurable to you, not what it should feel like? I know we probably, call our friends and like, hey, what was it like for you? What was it like for me? This and this and that. Our parents give us some advice, our best friends, our neighbors, our aunt, whatever. And we start talking about like, what should it feel like? And we forget what we want and what is pleasure to us. And when we talk about having some sort of disease that comes along with pain, that comes along with so much downtime and just other stuff, that we just forget how to add joy in our life, right? We just don't have fun anymore. And we dismiss all types of pleasure, not just sexual pleasure. So, what activities make you feel good about yourself, right? It's a great question. We want to stop denying ourselves of what can bring us pleasure. And I think we just feel guilty. We shouldn't have time for it. I don't know. I mean, people have different thoughts about why they just push it away. And often we have to look at the cultural and our religious backgrounds. We think pleasure is sinful, especially when it comes to sex. So we just don't want to talk about it and don't want to feel it. And then we just shut it out completely out of our lives, right? So we also want to talk about what's going on in our minds. A few years ago, the Endometriosis Summit was all about changing the narrative and changing some of the stories that we've come up with and say that inner chatter and that inner critique, right? And so we want to switch some of these metaphors. And I wonder how common the following are and how often you say these to yourselves. My body has let me down. I hate it. Just cut out. I used to have a patient that said, like, just cut me from waist below. Waist below, take me. I'm happy up above. Just take it all away, right? Or I just block that part of my body out. And that I hear a lot about scars, right? Oh, like, why are you touching my scar? I ignore that. So it's such disembodiment. We're just, again, we're just shutting it down. We're just like closing it behind a door, hoping that nobody will ever talk about it. And we want to start thinking about it in a different way. And we want to have a more positive talk about ourselves. So we talk about pleasure, we don't really have to think about sexual pleasure, right? So something that's pleasurable to me is, and I envy you, Sally, in Florida, is in the summer, just walking on the beach, seeing the ocean, seeing the sea, putting my feet in the sand. That just gives me such joy. So maybe everybody could just write down, like, what are some of those things, not sexual, that bring you joy, that bring you some pleasure? Often with the negative chatter and that inner critique and all that, we get into the same patterns. We go into the same behaviorals. So I do want to offer some things like cognitive behavioral therapy, which is not my specialty, obviously. But those you can seek out some help where somebody can help you and train you to change these thoughts and behaviors, right? But what about our breath? We talk about vagus nerve and nervous system activation. Just tune into the breath, meditation, and then just mindfulness, connecting to your body. So we want to know what appeals to you, what appeals to us, right? Can you dig deep into all of your senses and figure out what you like, whether it's a touch, hear, see, taste, what really intrigues you and what appeals to you? And then you want to back off from the things that just don't. You want to minimize them and remove them, whether they're sexual or non-sexual. Um, you want to know what your turn ons and turn offs are, right? And we want to think about sexual interest being beyond our hormones. There's so much more to sexual interest than just our hormones. How about how confident we feel, which we'll talk about in a few more slides? Definitely goes along with endometriosis, with this disease. We want to understand what erotic cues we're really into and what erotic cues we want to give and what erotic cues we want to get, right? But we also want to know that, like, let's say you had the flu this week, right? You're probably not gonna want to be that into sex. You might have a thought about it, but deep down, you're probably not gonna want to have sex, right? And that happens with flares, especially with endometriosis. And then we want to think about the context. What's going on with our external environment and our internal environment? Where are we? Something might have been really sexy and fun in one place, but then we brought it into some other place and it just does not work. So the context really makes a difference. And then playing. What happened to playtime? What happened to our childhood games? So take a moment now, close your eyes, you know, dig deep. I don't know how old people are in this, but I got many years to think back. Think of some memory you have of a game you played with your friends, by yourself, when you were growing up. Okay. Does that bring a smile to your face? Does that make you feel happy? Does it make you giggle a little bit? And that's really what we want. We want that dopamine to flood you. We want the happy juice to give you all the fun, right? So think about playtime. So let's introduce a few topics. The dual control model of sexual response came from the Kinsey Institute. And it talks about sexual excitation and sexual inhibition. Desire, which is kind of the balance between those two, is the interest and the appetite for sex. Okay. So our sexual brain has this gas pedal and it has a brake. It has the accelerator and it has the inhibitor, right? The accelerator, all those things that are responding to stimulus, and the brakes are anything that just push it away and just inhibit. When we talk about sexual response, we could think about Masters and Johnson. They had their four-phase sexual response, which included excitation, plateau, orgasm, and resolution. And then Helen Singer Kaplan created the triphasic sexual response, which she brought in desire. She's like, where's the desire? They didn't talk about desire. So her parts were desire, excitation, and orgasm. So like I said, desire is that appetite. It's like that, that start off. And why does it change so much for some people? Why are some people lacking desire? Why are people hyper in it? They want more. What controls whether you want or don't want sex? Well, we could probably spend a whole night about this, but it becomes that balance between that excitation and the inhibition, that brake and that accelerator. And if you think about it, we probably could list so many more inhibitors and so many more downers in our sexual life than we can think about excitation. So we talk about the balance to get that desire, and we want to look beyond our hormones for about that desire. Are we good so far?
We're good. We're excellent.
Okay, awesome. I'll keep going. All right, so where's the problem? Too much excitation, too little excitation, too many blahs, too many downs. I'm going to say most likely that's probably where most people have the issues. There's too many brakes. Because in order to be aroused, we have to activate that accelerator and deactivate the brake. We got to get excited and get rid of the inhibitions, right? So going back to the excitation, what are the things that you love to see, to touch, to smell? What are the things that excite you? So maybe it's a romantic gesture. Maybe it's flowers. Maybe it's getting compliments. Maybe it's intimacy, holding hands, spending time with somebody else, spending time with yourself. Maybe you like to gift gifts. You like to receive gifts. Maybe it's a date, whatever, a movie. But sometimes you don't know that it's there until you actually feel excited. And I want to kind of go back to the desire aspect, because when we think about desire, there could be a spontaneous desire and there could be a responsive desire. And most of us probably have more responsive. And that kind of goes along here with the you don't know it until you feel excited. So I didn't think I was in the mood, but wow, my partner just brushed by and like touched my hair and like, ooh, baby, now I'm ready. Or, I bought this new vibrator a couple of weeks ago. It's been sitting in my closet in a bag. Take it out. It's working. Oh, wow. Okay, now I'm in the mood. So it might just be a response to something else, right? And what are your inhibitors? What are your threats? What's putting that foot on your brake? Is it physical? Is it psychological? Is it part of your relationship? Is it a stinky, smelly room? Is it a over perfumed room? Do you not have privacy? Are there other people in the house? Are there other people making too much noise in the hotel room next to you? And important things are you didn't have consent, or you're not giving consent. Your safety is vulnerable, and you're bored. And I would say a lot of people are also just bored. They're going in with the same thing over and over. But we also want to talk about the second break, which is kind of that performance anxiety, and the fear of failure. And what if I don't have an orgasm? So we create these, I must have these goals, and then we're just down on that. So know what excites you, know what inhibits you, get that balance, and then you get your desire. So you probably can't change the mechanism, but you can change what brakes are considered as your threat. You can change what accelerator sees as exciting. You can change the context. Now you want to learn how to stop hitting your brakes. And some of the things you can use is working on reducing stress, being affectionate towards your body, okay, not just somebody else's body, letting go of those thoughts, those false thoughts. Remember that should be. No, it's not what it should be. It's what you want it to be. How do you visualize it? What do you want out of sex? So let go of the false thoughts of how sex is supposed to work and focus on what works. So many times I um I hear the stories of the I can't, right? I can't do this, I can't do that. And I play a role in that too. I mean, I say it often, and we have to start focusing on what can you do, right? So what works? What sexy things work for you, right? And let go of the I can'ts. Stop trying to want it. Don't force yourself to want to have sex. Start feeling it and remove that performance pressure. Sometimes you just have to remove the goal of orgasm. And I highly recommend that. And if there isn't an orgasm in your sexy time, it's okay. Feel the feels, feel the yummies, feel the excitations, feel what you want to feel. And if it's something that you don't want to feel, next time, throw it out, right? So, how you feel about you as a person and your sexiness is crucial. Body image is probably a very sensitive topic in the endo community. Research has shown that body image is quite poor in people with endo compared to people without. There is clear, significant sexual distress in the endo community. And so I want you to come up with some sort of a mantra that helps you remove some of that distress, helps you remove some of that poor body image. I'm attractive and I'm interesting to other people. Um, it is pretty clear that somebody who has poor body image is going to you're going to see that from the outside, right? So if I'm walking around and I'm like, ugh, I don't like the way I look, I don't like the way I feel, these clothes don't look good on me, I'm gaining weight, I'm losing too much weight, whatever it is, I'm too thin, I'm too fat, I'm too this, I'm too that, that aura is seen by the people around us. And that's where we have to start. I'm attractive and I'm interesting to other people. Gain some confidence, gain healthy habits, anything that helps you feel better, whether it's better dietary guidelines, drinking more water or chamomile tea. How do you get better sleep, right? Take a nap if you need to, meditate, and limiting the screens. Because if we talk about the screens, we're all probably on social media, and that is one of the top places that we're getting this horrible body image, right? We are getting such negative, again, what I should look like, what sex should look like, and that's where we're getting it, all on social media. So limit your screens and connect socially, whether it's virtually or in person, because connection makes the world go round. And do you know what sexuality is to you? What are your thoughts and feelings around sexuality? What are you attracted to? Who are you attracted to? What kinds of feelings do you want to feel when you're being sexual? What kind of thoughts do you want to have going through your head, right? Does your partner actually know that you're having pain? Does your partner know that when you're hugging or kissing or having intercourse or anything like that, do they know that there's pain? And if not, tell them. And what can you explore beyond your limitations? Remember, I said, get rid of the I can'ts. What can you do now? So we want to talk about a little bit about pain management, and this is your own pain management, because unwanted pain is not normal. And unwanted pain is not going to be taken away by any glass of wine. It might feel a little better, but it's not going away, right? And tolerating pain, I guess that could be an option. But when it comes to sex and sexy time, I'd rather you not just tolerate. I'd rather you get rid of or find something that you could do that's not painful. So listen to your body, right? Remember, when the brain is in a stress state, everything is perceived as threat. So if you're coming in all flustered and you want to have some pleasurable time, you're most likely not going to find it. Be patient, okay? Having pain with sex one time, two times, five times, it doesn't always mean that there's an injury. It doesn't mean that if you just had surgery, it doesn't mean that endo is back. We have to kind of look beyond that. There are a lot of other reasons why sex doesn't feel great. And one of them could be that you just weren't really into it, right? Like, so it's way beyond the injury. And for sure, self-care, because pain is a response to threat. So we have to look into kindness. We have to have some compassion towards ourselves. We have to have some love towards ourselves. And yes, of course, we want to experiment. Okay. We want to understand how the fear of pain and fear of failure can be disruptive to our sex life. Part of that is experimenting. Pillows, positions, toys, time of day, morning, night, showers before, showers after, baths, pools, lube, uh, flavorful lube, I don't know, edible underwear, whatever it is. Experiment. You don't know until you try it. And if we want to talk about positivity and sex positivity, experimenting is just a part of it, and not feeling shameful about that, for sure. Concentrate on what you like about being touched. Where is it that you like to be touched? And it doesn't have to be in the genitalia or in the breasts, an ear, a neck, your back, a massage, a tickle, whatever it is. Concentrate on that sensation of touch. What kind of touch do you like to get? And what kind of touch do you want to give? And where does it feel good? Sex is not intimacy, they're different. So if intimacy is something that you are seeking, then seek that. And playfulness. There is no script when it comes to sex, and there is no script when we talk about pleasure, for sure. And there's going to be mistakes, and there's going to be awkwardness. The best sex is one that you can actually just have a little giggle in the middle of, and play, for sure. Go back to those childhood games. There are card games that you can help to initiate sex with. You can send flirty texts. You can shower together. How about dancing? Let's talk about dancing. And I'm not a somatic therapist, but I've worked with several somatic therapists, and movement and just tuning in between breath and movement, you might just find your next mojo, and you might think even going to dance before having a canoodle later on tonight. How about nicknames and your own little sexy language? Whether you're solo or coupled or thrupled or anything else, there is audio erotica, there's video audio like Dipsia, and video like Belisa. Those are definitely sex positive sites. There's role playing, fantasy playing, you name it, sky's the limit. You can find it these days, for sure. But you have to be comfortable or willing to experiment. And we have to prioritize it, and it doesn't always have to be penetrative. So it could be non-penetrative, but you have to find time. Sometimes it's going to be clinical looking, and sometimes it's going to be not clinical looking. You want to communicate with your partner. And this is where you could talk to friends, just to get some guidance, but don't compare, and don't think your friend's pleasurable life is your pleasurable life. You want to communicate. So I said that, and then find support, whether it's a sex therapist, a sexuality counselor like myself, your PT, OT friends, your doc, anything like that, and schedule it in. Make time for pleasure, make time for joy, make time for feeling good. And that's all I have. That's my contact.
Excellent. Wonderful, wonderful. All right. We have some amazing, thank you for that presentation. You can go ahead and stop the share.
Well, if it lets me. I want to stop. Oh, duh. I missed my sign. Sorry. There it
All
is.
right.
Yeah, sorry.
Excellent.
Found it.
Excellent. Okay, we have some questions submitted throughout the day.
Okay.
One of which says, I think it's very interesting, something we hear a lot. My partner is afraid of hurting me. So the person went through a lot of pelvic PT, did an excision, and now they're ready to get back to it. Talk a little bit about the experience of, where somebody can go. My partner is afraid of hurting me. Like, how can they work through that as a couple? I know you're not counseling, but
No, no, for sure. So I always say kind of start from the outside, especially if sex has not been on the menu. Let's talk about how about a massage first, right? A neck massage, somewhere maybe far away from where the surgical sites are, far away from any of like historical pain. Start somewhere else. Um, Take your partner's hand and show them where they can touch, right? Show them the depth of the touch. That's where I was saying, like, feel the feels, understand your senses, because I might like a deep touch and you might like a light touch. I might be really ticklish, so I want like a firm touch, and you might not. So I think just be the controller, really. Show them that they're not hurting you.
excellent. And what do you have to say to couples who have experienced infertility and sex was so goal driven? What about learning to experience pleasure under those circumstances? I know you already spoke a little bit about it.
No, it's okay. And I have to say, I personally don't see many couple like doing it as a couple aspect, but um, well, one is remove the goal, right? You know, what's the new goal? Work on the new goal. If the goal is not fertility based right now, then work on a different goal. What is the new goal? And maybe play a game. Find a new experiment. Bring a toy. Something that is a little bit more erotic to the focus, where it might take your brain out of like this was for baby making, and now we are not baby makers.
Excellent, excellent suggestions. Another one of one thing I wanted to discuss, I think the presentation talked about it very well.
Right.
Uh, we and we did this for a long time with nutrition too. We live in this prison of shoulds or can and can't. So in nutrition, it's I can't have sugar. I can't have sugar. I'm going to drive everybody nuts around me because if I eat a bite of sugar, it's going to make my pain worse. And it does stem from probably 20 years of being minimized that you think the only thing you can control. Now, when we talk about experiencing pleasure again, what are some of the shouldas that you think people with endometriosis should let go of?
So reverse the I can'ts is what you're asking?
Right. What are some of the
Oh,
common I can'ts that you hear in your practice?
oh, I hear all them all. I can't because I flare. I can't be on my back. I can't be on my side. I can't be on top. Um, so I think every day is a new day, right? And for sure with endo, every minute could be a new day, right? So it goes kind of back to even the excitation of I didn't know that excited me until I tried it. You know, don't knock it till you try it. Don't work on the I can't. What can you do? Um, be explorative. I think go beyond sex. So let's go back to the dancing, right? Maybe dance in your living room first and then do the thing that you thought you should not do. I think when it comes to sex, right, different than nutrition, the only time we say stay away from sex is maybe right after the surgery, or like obviously that it's just creating so much pain. I don't want negative feedback on and on and on. So, okay, I was able to do this, so let's do this plus add a something else. But I really don't think you know until you actually try. So I don't think there's really should nots when it comes to sex.
Yeah, I think it's important for people who are listening or watching to hear that, right?
Yeah, yeah. I mean, unless you know that, it's gonna, I mean, we'll say if you really know something's gonna flare you up, like you are not moving later on, then yeah, find something else. But it might change in a week, 2 or 3. That's why I also mentioned that you have to in the pain management slide that you have to know that yes, you might have pain with sex, but it doesn't mean that you re-injured yourself or the endo's back, right? And that's where like cognitive behavioral therapy, you're going back to those same thoughts. They're in there. That's our old brain. Like it's gonna fetch real fast. It's gonna light up real fast. So we have to create our new memories. And by doing.
By doing, yes. Okay, I'm looking at my questions that are here. I think, how do you help someone who is what are some good tips? And we're going to have a whole workshop on self-esteem and endometriosis, but on rediscovering yourself, not just sexually, but you have to feel good to be good. So what are some of your tips on rediscovering yourself in a positive light?
Okay, so I'm so not a shopper, but this is the first thing I could actually think of when I go shopping. I buy a new outfit. Like, who does not like something that they found and looking in the mirror, and maybe you get a compliment in the dressing room, or you bring your kid with you or your cousin Betsy or whatever, and they're like, yeah, you look hot. I think something like that would be a great way. Go get your hair done, right? And I'm talking to somebody, this is me that I don't do these things often. So I think something to glamorize yourself always helps.
I think self-esteem also is patients used to write post-it notes and leave them in their bathrooms because it's a patterning of the brain. So,
Yeah,
instead of thinking like, sometimes that first step to the floor in the morning is a little rough with endometriosis, instead of the first message being, "Ugh, I can't believe I have to go through today." What is the positive message that you
yeah.
can put in place? The
I'm
work,
safe. I'm
yeah,
safe.
I'm
Waking up and saying I'm safe. One of the slides saying I'm attractive, but you have to believe it, right? You can't just be like, "Yeah, I'm attractive. I'm safe." Right? We have to believe it.
well, you can
Every
fake it
day,
till
I
you
got
make
my
it.
own inner critic, right? Like, I mean, we
Right.
all have our little imposter. I have my little Tweety bird that hangs out. And right, just find your little mantra that will pick you up. But maybe it's also doing one of those activities that brings you joy. Go get an ice cream. I know maybe sometimes not dairy and all that stuff, and you don't want the sugar, but sometimes you just got to live, right? Sometimes you just have to live. It's like 80% and 20%, or 90 and 10, or 50 and 50 in my
Well, I
life.
thought your example, go put your tootsies in the sand.
Yes.
Go put your snow boots in the snow if you're one of those people. I am not one of those people. But take a moment to see the horizon. You don't have to
Yes.
always, it doesn't have to be some amazing sunset, but look at the horizon.
Yes.
Sometimes I think 10 minutes in a dark room where no one bothers me is very nourishing as
Yes. I mean, alone time is definitely, I give myself timeouts. I mean, I've said it to my kids. I'm like, mommy's going on a timeout. Like, it's okay. Read a book, write something. Maybe journaling is a great way for, bringing back your self-esteem. Um,
So
but
we're
you
gonna have this whole
still
workshop.
digging, yeah, it's still digging deep inside, like what sits well with you and bring it out.
We're gonna have this whole workshop on the sort of intersect between society and endometriosis and self-esteem, and people are gonna draw themselves. And I
We
had to
did a
order all.
drawing one in Hoboken once, right? We did a drawing one in
Yeah,
Hoboken.
this is a little similar, but
That was good.
we have butchers paper on the table, and people are gonna have to draw their vision of themselves. There's gonna be a little bit of before and after.
Nice.
It should be pretty cool.
Yeah.
A little different. All right. So another one we get all the time, pain with orgasm. Very common with adenomyosis and also a common with adhesions. Talk a little bit about, I know, so the goal for some people maybe isn't orgasm, but talk a little bit about navigating that situation, pain with orgasm. Right now,
Yeah.
while YouTube is blocking us for sure, but it's
Right,
important.
right.
We're chatting, so we got to get this out there. It's okay.
Okay. So, I mean, one thing is, I was kind of proud that as a pelvic health therapist, I didn't write pelvic floor at all, except for about myself in that whole thing. So, I mean, clearly, you do want to work with your PT or OT on that aspect, but you can just use the concept of edging. So, just bringing yourself highs, but stopping at the highs, and it's used for different reason sexually, but you still get those, oh, that build up, build up, build up, and then you can kind of walk away. So you have to kind of find the line. We talk about it often in premature ejaculation in the male penis owner side, but if you kind of bring and stop and then come down, you kind of start learning where it is that where is your threshold, right? The downside is that it also doesn't feel great to people. Um, so you might just find something that, like, let's say oral sex. I don't know, you probably have never had an orgasm with oral sex, maybe, but it feels great. So you can use a tool that is not going to get you to an orgasm if you already know that.
Very important. I think we have to like lift the veil off of these discussions. And I feel like if we're not going to do it, who's going to do it?
Yeah, I'll
You know?
talk about it.
Yeah, no, very important. So something else that came up, actually, I think you were at that summit, is that, what do people do when they feel like their partners, or if they're single, the society, I guess, is not attracted to them anymore, but they still have to maintain this relationship? And I think it's not that we're going to give you an answer here on Endo Summit Live. It's that we're going to tell you that as pelvic physical therapists, we hear this every day. And I don't think every couple is going home and like ripping the wallpaper off and having sex even 2 times a week. And it should be normalized that couples go through things. So, what do you do when it's that how to work with somebody who feels that their partner is no longer interested in them?
So it brings a few topics. I wonder first, is that actually what's happening, or is that the narrative that's been created? Is it something going on with their own image? And probably, I'm gonna most likely say that is. I think when it comes to couples and that kind of thing, feeling that they're not attractive, I would say probably 9 out of 10. It's kind of the last conversation. It's the partner thinks they're going to hurt them, so they're backing off. Now this other person is saying, "Oh, they don't want to touch me because I'm not attractive." So it's really I think it's a created story for most people. I think most people don't realize how much their significant other is attracted to them. Um, yeah,
Do you hear? I hear that when I practiced, I heard that every day. Do you hear that almost every day?
I do. I hear they don't want, and yeah,
So
yeah.
let me tell you funny. So you were at the summit when this came up, and for some reason I ended up going home in like a van, and it was all MDs and me. and some of the MDs wives, and they all sat there, the MDs, not the PTs, not the patients, and they were like, well, that's it, if sex is gone, the marriage is over. And I turn around, I'm like, what world are you living in? Because I don't think, first of all, I don't think that's true. It's I think if intimacy is gone, and intimacy and sex are two different things, that changes a marriage. If communication is gone, that changes. I love how I'm giving marriage
Yeah,
advice.
yeah.
But I found that amazing that the patients felt this like breakthrough, like, oh, it went up on the screen by accident, but now we can all talk about it.
Right, right,
And then the doctors were like, oh, whatever, their marriage is. I mean, there's such a disconnect between what's real for the 200 million people in the world with endometriosis and what is the perceived perfection of marriage,
right,
right?
right. What is a marriage? Well, I mean, I this has nothing to do with per se with
And it
endometriosis.
doesn't have to be
I've met
marriage, the
Yeah.
partnership.
Yeah.
Right,
I've
right.
met people, they come in and let's say they have urinary incontinence, they mention something about sex, but their partner is no longer interested. It's just part of their, I think every relationship and marriage, you do what's right for your relationship and marriage. And there's way more than we think sexless relationships at this point. But even going back to the, what should you do and what should you not do? Let's actually celebrate something. So let's say you're a person, you've had surgery, you feel good, you are 50 years old now. Like, you don't have to think about pregnancy. You might not have to think if there's kids at home anymore. Well, I'm 50 and I have kids at home, but there's actually things that are good about some of the things that were going on, at different parts of our lives. Perhaps somebody did have a hysterectomy, but hey, now we could do other things and I don't have to think about this and that. So there are ways to celebrate sex in a world of a chronic disease.
I also think your advice about like loving yourself and the energy that you send out is very important, because the concept that like the one partner should please the other and they are there to please the other is really grounded in a sociological patriarchy, not to bring up big words, but that it you shouldn't be in a relationship only to take care of the other person's needs. You each, whether it's emotionally or what, you each have to make yourselves happy before you
Yeah.
can be in that relationship,
You do
right?
you. Your mask has to go on before you put other people's masks on. Um, I am a promoter of self-exploration, whether it's sexual or not. Eh, Often people with that I meet with trauma, they're less interested, religious backgrounds, things like that. However, you don't know nobody can know your body unless you know your own body. So when you asked, before about the partner, then you need to take control. You take their hand. Place the position. Like you do you.
Excellent.
And
Okay,
love
so
yourself.
we are, let me check one more time. We are rounding out our time with Neva Herzig. Neva has joined us. Neva is very famous to the Endometriosis Summit because our original cover photo was all these people with their arms in the air dancing. And it's because she made our entire crowd exercise. I think one of the top 5 highlights of all of the Endo Summits.
Oh, thanks.
If I put that
That was
together,
the
I would,
OG.
yeah, the OG. We're gonna have to eventually, we gotta, it didn't work out for this year, but it's gonna work out for another year. I already have the dates for next year, by the way. But what do you find great about the Endometriosis Summit?
Um, Not just one thing, many. The the community for sure. The bringing of patient and practitioner is probably one of the most amazing things as a practitioner, and I see it in the patient side. I think the open conversations and the dedication, the physicians you've brought in the PTs, the OTs, everybody. There's always something to learn, and there's just such passion for helping the community.
Yes, excellent. I also think that what I love about it is exactly what I was talking about. Like the patients felt like the lid was off and they could finally talk, and the PTs were like, great. We're finally talking about how plenty of people are in sexless relationships and like it's great. But then like the other side of it is like the MDs who are like, oh no, and I think that's the crux of the endometriosis summit. It's finally like the patient's time to be like, what are you, crazy, MD? This is what life is really like with the disease. You know, you're living
Yeah.
in your head. We are the people who are really living with it. It's kind of an
I
interesting,
like the non-filterness about it too.
it's an interesting community. Yes. So we will be in Orlando, March 28th through the 30th, 2025. And we hope to see you all there. Neva, people want to reach you. I know you put up the slide, but tell them again how they can get you and tell them where they can get you on socials.
Sure. So Core Dynamics Physical Therapy is the name of my practice in Northern New Jersey. If you could search that up, you'll find me. And Facebook and mostly Instagram at Core Dynamics Physical Therapy. But I'm sure you can Google Neva Herzig, you'll find me.
Right.
There's
You
not
used to
that
have a
many of
great
us.
blog. I don't know if you've kept up with it.
A great blog.
Yeah, on Core Dynamics.
Oh, sometimes, every once in a while.
Yes. But it's
A
very
lot.
exciting to see this. You know, PTs, we're never done learning. We're never, I think that's why we like being PTs. We're never done like with the next step. So it's very like cool for me to see this expansion of your career. So I
Thank you.
congratulate you on going through the
Yes.
full program.
I think I'm on pause at the moment. It just came up in a conversation at a home and school association meeting. I'm like, well, we're always learning. I'm always learning. But yes, I need to
But
now put this all in.
right. We think the Endo Summit will be approved for Ginger's course, by the way. Just, you know, throwing that out there to people watching, but
Yes.
that is no sexual counselor certification like you did. It's just 2 little credits, but
No, no. All good.
uh, all right. We look forward to seeing you again soon. Thank you, everybody, and good night.
All right. Thank you.
Thank you